Hello, everyone, and welcome to today's COVID-19 Planning and Response Office Hours. My name is Natalie Matthews, and I'm just going to give a very brief welcome and overview of some housekeeping tips, and then we will get into today's content. So first and foremost, I just want to remind everyone that we are recording all of these office hours and webinars that are happening over the next several days. And a recording of the slides, a recording of the session along with the slides and a copy of the Q&A will all be posted to the HUD Exchange within 2 to 3 business days. So please do just give us a couple of days and then we will make sure the content gets posted. If you have any challenges with audio throughout the course of our time together today, I do encourage you to just jot down the phone information, the audio information that's up there on the screen right now. I will go ahead and put that in the chat box as well in just a moment. But that toll-free number is often the best way to get audio. So if you're having trouble with the other phone numbers or listening through your computer, you always have that toll-free number as an option. I also just want to mention briefly that everyone is going to be muted throughout the course of our time together today, but we absolutely want to hear from everyone during the webinar. So the best way to do that is going to be to go ahead and put a message in through the chat functionality in WebEx. You should see on your screen right now a series of icons in the bottom of your WebEx screen. If you go ahead and if you click on the one that looks just like a message bubble, that'll open up the chat functionality for you, and that'll let you type in questions, comments, feedback, anything that you'd like to share with us today. When you are sending those messages, though, please do make sure to go ahead and select all participants. That should default. That should be what it automatically is set to, but if it doesn't, please just click on the menu on the right-hand side of your screen and make sure that's selected, because that will make sure it gets to all the attendees as well as all of the great presenters that we've got today. So with that, I'm going to turn things over to Norm Suchar, the Director of HUD's Office of Special Needs Assistance Programs. Norm?
Thank you very much, Natalie. And I want to quickly introduce our speakers today, and then we'll get right into our content. So from HUD, today you'll hear from me. We also have its resources on the line, Abby Miller and Juanita Perry, great resources on coordinated entry, which will be one of our featured topics today. Marlisa Grogan is also on the line and will be giving us some updates. From the Centers for Disease Control and Prevention, we have Emily Masitis. And from the Department of Veterans Affairs, we have Roger Casey. He'll be giving a nice presentation on promoting wellness. So those are our speakers. So we have a nice tight agenda today. We'll have plenty of time for a Q&A. As Natalie mentioned, if you do have questions or comments or anything you'd like to share with us, please feel free to do so in the chat box. You don't have to wait for any particular time. You can just toss questions and comments up there. We're very interested, obviously, in hearing your about anything you've encountered or done successfully or struggled with regarding coordinated entry, but you can feel free to address any topic you'd like. So let's move on to the next slide, please. So next we'll have an update from Emily Masitis from the Centers for Disease Control and Prevention. Emily?
Hi, everyone. This is Emily Masitis, just going to give a quick update on COVID and our resources. So next slide. This is our daily case counts as of yesterday. Almost 1.7 million cases reported in the U.S. We see a slight downward trend as we're coming into June, and this is mirrored in the emergency department visits that we are seeing for COVID-like illness among people experiencing homelessness. Next slide. So I wanted to just draw everyone's attention to a reopening checklist of considerations that is on our landing page. So this is the URL. Mostly what we want to do with this reopening checklist is to reinforce things that we're already thinking about. That is to be using your whole community coalition to do your planning as the landscape of COVID changes. Continue your basic prevention efforts unless you're advised otherwise by local health authorities. Continue connections to care. And then, of course, also importantly, we want to keep maintaining the availability of isolation and quarantine locations because there is still the potential for spread, and we don't want to be caught off guard by needing quarantine and isolation locations and having closed them down. And then another thing to be thinking about is making sure to be having discussions about what changes are going to look like, whether or not there might be potential influxes into shelters or into other services, and planning for how to keep COVID protections in place if those happen. Next slide. We also, we have these other materials on the landing page. We recently updated the symptom screening tool. So that has updated information because some of our basic clinical information that we know now based on studies of COVID-19 shows that there's quite a number of symptoms that someone can be expressing when they start to feel symptoms of COVID-19. So this tool now just has a link to that expanded number of potential symptoms. And next slide. And that's it. So please let me know if you have any questions. Happy to answer anything that you guys are thinking about. And thanks so much for everything you're doing.
Great. Thank you very much, Emily. Next, we have some content from Department of Veterans Affairs, Roger Casey. Roger, please take it away.
Great, thanks. Can you hear me okay?
Yep, you sound great.
Great. Hey, everybody. This is Roger Casey with the National Center on Homelessness Among Veterans. And I don't know if you're familiar with us, but for sure, check out our website. I think we have the web address on this last slide. The center promotes and conducts research on causes and contributing factors to veterans' homelessness or veterans experiencing homelessness. And we also serve as a resource for both community and VA staff and develop models, intervention models that we test and see if they're reasonable and valuable to disseminate to other areas and larger scope. The past month, we realized within the department there was a lot of self-care and wellness needed by staff, but most of the staff was getting general information, which was really good, obviously, but there was less information that really was specific to our programs around the country and our staff working in those programs that were serving homeless veterans. We felt that it was a unique population, obviously. Many folks on this call work with that population. And there are sometimes unique challenges and barriers, and obviously that can affect the effectiveness and the efficiency and both personal and professional stressors in lives. So we developed podcasts specifically for our staff. Next slide, please. Oh, thanks, Wal. That's kind of what I said. Next slide, please. So we developed a series on self-care specifically for our VA staff that work in homeless programs, and it was a series of 7 podcasts, caring for yourself, self-recognition, and recognition of your own emotions as you're working with others. We had a mindfulness podcast, also a recording and an interview with someone who is in the trenches, actually, a program manager of a homeless program. And also we worked with a specialist in sleep and sleep disturbances and how stresses throughout your life throughout your day can affect your sleep and the fitfulness of your sleep. We thought that was important. And also a nice podcast on how you can enlist your peers, your colleagues, to provide support. We all are going through some uncertain times, and we believe it was important to offer this to our staff. Next slide, please. So these podcasts are available internally to VA, but we also have them on public podcast hosting sites. If folks are interested, it may be relevant to the work you do or your staff work. So please feel free to look for these podcasts on the following public sites. Next slide, please. And thank you. Appreciate the opportunity to participate. And if anybody has any questions about these, my email address is listed there, and these podcasts can be reached actually through our National Center website or on those public hosting sites. So unless there's any questions, thank you for the opportunity.
Great. Thank you very much, Roger. And I know some people asked for those links to be posted in the chat box, and they're right there. So great. Thank you so much. So next, we're gonna move to the next slide, please. Next, we're gonna have a couple of quick HUD updates from Marlisa Grogan. Marlisa?
Hi, everyone. Great to be here with you. We wanted to just follow up Emily's presentation with some additional recommendations from the HUD perspective as communities across the country start easing restrictions and infection prevention efforts, especially in the business sector and for recreational activities and facilities. We're advising homeless assistance providers to continue to be aware of your local COVID-19 situation and to really be vigilant and continue to implement CDC social distancing recommendations. Keep up with your strategies to decompress congregate shelters within your community, and keep on top of infection control, which entails continuing hygiene measures, the hand washing, wearing masks, encouraging cough etiquette among your program participants and staff, and continue to coordinate with local public health. That partnership remains vitally important to make sure that you're keeping up to date on the status of the COVID outbreak in your community, the sanitation measures that should be in place to keep everyone safe, and the best ways to protect people in encampments. Next slide, please. So HUD and RTA providers have learned of many communities that have successfully used different types of temporary non-congregate sheltering options. We included an example here, hotels and motels, to treat and protect people who are COVID positive or exhibit symptoms, and people who are high risk for poor outcomes should they become infected. So with that success, at the same time as states are easing many restrictions, it's important for homeless assistance providers to plan to shut down temporary sites only through extremely well-coordinated efforts in advance of any sort of closure date of non-congregate shelter with the local health department and emergency management, and never really attempting to do this without directly tying that shutdown to rehousing efforts. In other words, making sure that there's a concrete rehousing plan so that people who are in non-congregate shelter settings are not exiting to the streets or encampments or riskier congregate shelter settings. Next slide, please. So we are reinforcing the need to act with urgency for your rehousing efforts to make sure that people who are in non-congregate shelter settings in temporary or in other temporary locations are rehoused, and to remove unnecessary process barriers, making sure that the rehousing effort is successful and as quick as possible. Your rehousing activity can be focused on temporary sheltering locations, and the reason being that people served are already prioritized based on their COVID-19 vulnerability. You've already done that sort of targeting. ESG-CV resources should be used to directly support the community's COVID-19 homeless rehousing strategies out of temporary shelters. So that's a really good use of your ESG-CV money. And also consider and think strategically about other resources that you can use to support your homeless rehousing strategies. And one really obvious resource is CDBG-CV. With that, I'm going to turn it back to Norm.
Thank you very much, Marlisa. And we're going to go into some discussion about coordinated entry. We have had several questions about coordinated entry throughout the office hour series, and we've had some questions come in through other channels. And we wanted to take a minute and sort of step back and really think through how to use coordinated entry to better set up your COVID response, your CARES Act implementation, and your overall work to prevent and end homelessness. So we wanted to step back and start by thinking through, as we encourage people to look at their coordinated entry, we always want to do it in the context of what are the overall goals of your system. And coordinated entry should very directly support those goals. So one thing we know is that for people sleeping in crowded areas or who are unsheltered, that housing reduces their risk of contracting and transmitting COVID. So it's a really important public health intervention going forward. It also obviously contributes to our work to prevent and end homelessness. So that's just something sort of helpful to frame the discussion around. And then it's important to take a look at the resources that are available and understand, like, what can you do? I think for most communities, coordinated entry grew up in a time of, having a certain amount of resources, certain amount of permanent supported housing, shelter, rapid rehousing, those kinds of things. And they've changed, that mix of resources has changed a little over time. And so people have made, I think, sort of adjustments to their coordinated entry as they've gone along. But now with CARES Act, there are a lot of new resources available in a lot of communities. Certainly there's the first round of ESG CARES Act funding, but there will be another round as well. So with more resources on the table, it's really important to step back, look at what those resources are, re-scope the goals that you have for your system, and then start by maybe identifying a few goals that you think are achievable given your current resources and that will help you improve your public health response and contribute to your goal of preventing and ending homelessness. So we've listed some examples here of goals you could set for your community. Obviously, every community is different and you have different resources and different numbers of people in different situations. So you wouldn't want to just copy and paste these, but these are the kinds of examples of goals you can set with the resources you have. So for example, housing all high-risk people out of congregate shelters to allow for decompression, addressing encampments with more than 10 people, looking at people who are in the high-risk category that CDC's identified, including things like people over 65 or who have respiratory problems, or who, for other reasons, are at high risk of really poor outcomes from contracting COVID, or looking at everybody who's, as they're exiting non-congregate sheltering and coming up with a housing plan for everybody. So these are all goals you could set in your system. And can we move to the next slide, please? And then then you look at coordinated entry in the context of those goals and say, okay, how do we use coordinated entry to prioritize and to facilitate people getting referred to and people accessing all those kinds of assistance? So you probably want to look at CDC guidance about who's at high risk from COVID and use that in your prioritization process. You really want to, as you're thinking about adjusting your prioritization process, you really want to think about, in a time of much more resources maybe than you've had in the past. So for example, in the past, maybe you had 10 slots of permanent supportive housing open every month, and now maybe you have enough funding for 1,000 to serve 1,000 households with rapid rehousing. Again, I'm using just made up numbers here, but the scale is really important here. So when you're prioritizing for 10 units of permanent supportive housing and you have, 1,000 people in your system, you're going to be fairly nuanced and fine-tuned in your prioritization. But if you're looking at, say, housing everyone who's coming out of non-congregate shelter, you actually don't have to be very nuanced in your prioritization, and you really only need to assess for what you need to assess for to get people that level of assistance. So if you've decided that you're going to rehouse everyone out of non-congregate sheltering, then that's really the only question you need to ask is, are you exiting non-congregate sheltering? And you don't have to use sort of all the prioritization tools you've created up until now. You can just use that as your prioritization for getting people into rapid rehousing. So again, the point here is that you should just prioritize for what you have available. And the fact that you've developed a lot of prioritization processes based on what the resources you used to have, I think is, in this time, it's okay to set those aside or set that process aside or create an additional process for the CARES Act resources. And I'll have a couple examples of how you can do this a little later. Another really helpful point, I think, is to engage in housing problem solving at any place you have a coordinated entry access point. So if you haven't sort of been engaged in conversations about problem solving or your community hasn't received training in problem solving, HUD has some resources, USICH has some resources on this, VA has done a lot of work on problem solving, there are some other resources out there. So stay tuned to the HUD Exchange because we will be posting more resources on this. But housing problem solving, just to sort of boil it down a lot, is just the process of trying to identify alternative places people can live instead of having to come be in shelter or to be unsheltered, to find alternatives. And even if they're only temporary, it gives you a little time to work on a more permanent solution without somebody having to, experience an emergency shelter or unsheltered episode. So engaging in housing problem solving at all your access points can be a really effective way at low cost to divert a lot of people, again, from sheltered and unsheltered situations. So let's move on to the next slide, please. So you have thought about your larger goals. You've identified the basic ways your coordinated entry will support your overall goals. Another step here is to look at homelessness prevention and incorporate homelessness prevention in your coordinated entry. So a lot of people are using CARES, not everybody, but a lot of people are using CARES Act funding for homelessness prevention. So if you're going to do that, it's important to know that ESG funded projects, including prevention, they do have to participate in coordinated entry. However, you can have a separate access point and a different assessment approach for homelessness prevention. So a lot of people will have, for example, physical locations that people go to for access to homeless assistance, but they'll have maybe a 211 for homelessness prevention assistance. Having that sort of separate approach is completely fine and fairly common, I would say. And then you want to think about your, think about your coordinated entry prevention strategy in the context of your prevention goals. So for example, if you set a prevention goal of, we really want to reduce, sort of do the twin things of reducing new episodes of homelessness and reducing COVID spread among our homeless population, you might want to target places where people are coming from are at high risk of homelessness and also high risk of spreading COVID. So you might want to, for example, target people being discharged from hospitals or other healthcare sites, correctional facilities, or other congregate settings. So you'd want your coordinated entry to be connecting with those settings, so people are being assessed either as they're exiting or hopefully a little before, so there can be a little planning done. and you want to make sure you have your prevention resources. Your prevention program is sort of designed to address people transitioning from those settings, and you have, you have your resource that's actually serving those individuals. So that's an example of how you might combine your coordinated entry process, your sort of overall community goals, and your CARES Act resources. One of the tips that we've seen related to prevention and rehousing and problem solving that I wanted to mention here is that a lot of communities, as they're doing housing problem solving, so again, this is where, say, at your coordinated entry location, people are, working with people who are trying to access shelter and trying to identify alternative locations for them. So one of the things that people do is they have an organization that administers both rapid rehousing and homelessness prevention assistance, because what can happen is, sometimes that individual will be will be at risk of homelessness, or sometimes they'll be actually experiencing homelessness at the time they come, and you don't want to have to send them to different programs, based on sort of subtle differences in their living situation. So you really want to, have a provider who can provide both kinds of assistance. So let's move on to the next slide, please. So then, you're looking at making changes to your coordinated entry based on your goals, based on your sort of overall approach to using coordinated entry, based on how you're implementing prevention in your coordinated entry. So one of the things you can do is just make temporary changes to your coordinated entry policies and procedures, right? So I think, you're required to have policies and procedures, but that doesn't mean that for addressing COVID, you have to go back through and kind of scrub everything and make changes throughout what for a lot of people is a 50 or 100-page document. You can actually just, add an addendum that says, for the next 6 months or until the public health order is lifted, this will be our approach to coordinated entry. Or for people in non-congregate shelter, this will be our approach to coordinated entry. And you can just do that as an addendum to your policies and procedures. You don't necessarily have to sort of do a complete rewrite. The same is true of your written standards. So COC and ESG funded programs have to adhere to written standards. They describe who is going to receive assistance. And for things like rapid rehousing, they'll describe how you'll decide how much rental assistance a household will get. And it is entirely appropriate to just take your existing written standards to just slap on an addendum that says, okay, for this CARES Act funded program, for these individuals, this will be our approach. Again, that's entirely reasonable. And so here's sort of another example as we were trying to think of creative ways to quickly implement something that can help during COVID. To support problem-solving approaches, you can just adopt a policy that says, okay, anyone who, through the course of problem-solving or in an outreach worker or in any other place in your system, if someone has identified a housing unit and they're ready to move in, or they would be able to move in if they had just say a one-time assistance or up to 3 months of assistance, you could absolutely create a prioritization policy that says that those individuals are just sort of quickly automatically get referred to a prevention or rapid rehousing program and don't need further assessment or prioritization. So again, a couple different approaches you could take. We're not saying these are the only approaches you could take, but we wanted to provide examples of things that are sort of, easy to implement quickly. So let's move on to the next slide, please. And then we really want to make sure that anytime we're making changes to coordinated entry or just in our regular course of managing coordinated entry, we're always trying to make sure that it is serving people well. And there are many, many different elements to that. So one of the comments that we had on earlier office hours is with respect to COVID outreach, is just the importance of having staff that people experiencing homelessness have trust in. And a lot of times that can be because they have shared experiences. So hiring people who have lived experience of homelessness, who have experienced deep poverty, can be really, really helpful. And those individuals can be way more effective because they have a connection that is really hard to replicate. It's also really important to look at people who have experience and skill working with racial and ethnic minorities, particularly Black and Indigenous persons, because those are, in many communities, the individuals who get left behind as we're developing our homeless assistance systems. So making sure in those hiring processes that you are identifying people who are really going to connect with your target population is just incredibly important. And then it's also important as you're thinking about sort of how your investments and your coordinated entry and all these processes work together, to look at investing resources in areas where you see disparities. So for example, if you're looking at a prevention program, look at neighborhoods where a high proportion of people experiencing homelessness come from. They tend to be minority neighborhoods overwhelmingly, or parts of your system where there's much more disproportionality than other parts, and investing CARES Act resources just, to improve assistance in those parts. One thing we hear a lot about is that various sort of prioritization approaches result in disproportionate levels of assistance based on race or other factors. And, one of the things we encourage people to do is to look at that and not just think about your prioritization tools. We're always obviously looking to improve prioritization tools, but that's telling you something about the types of assistance that are needed by different communities, and really look at investing resources in those types of assistance that people are scoring for. So again, always looking to improve how we do coordinated entry, and I think these are some really important elements to that. And so let's go on to the next slide, please. We have some key websites here. We're going to move into the Q&A portion of this discussion. So we'll be scrolling through some key websites, partner contacts, et cetera. So we are going to switch to the Q&A portion of this session now. And also, I just encourage people to jump into the comments and if you have, I haven't been paying attention to the comments as I've been presenting, but if you have examples of things you've been doing to your coordinated entry, please feel free to share them. I know a lot of other communities are really looking for tangible resources that they can utilize. So with that, first question I actually wanted to ask Emily. Emily, you mentioned the sort of checklist for as people are thinking about reopening, and in looking at the checklist, one of the messages seems to be that it's important to continue existing practices and not to sort of let up or to think that reopening means everything is safer. Can you talk about sort of, what are some things that people should be looking at changing with respect to as communities are reopening? What are things people should be looking at changing? And what are things that it's really, really important that people keep doing vigilantly the way they have been?
Yeah, thanks for that question. I think an interesting thing about reopening or even closing down is that neither of these terms really have applied to homeless services because they remained open for the most part throughout this wave of cases in the United States. So when we think about the surrounding community reopening, though, there's a lot of things to think about there in terms of the potential changes to spread within the local community, that spread could continue on a downward trajectory. It could stay the same, or it could go up when reopening happens. And because congregate settings and shelters are at higher risk for spread, we need to maintain protections at least for a while until advised by local health authorities. So when local health authorities start lifting other recommendations, then that's when the conversation can start about, can we start lifting some of the social distancing recommendations? It's unlikely that will be soon because we don't have a good protective measure right now other than some of these broad public health actions that we're doing. So that's the connection you want to keep making is with the local health department. Seek their advice on if there are any changes that need to be made. And if you feel that a change is happening that you don't have control over, for example, if there's an influx of people coming in for whatever reasons those might be, keep in really close communication to make sure that you have protections in place.
Great, thank you. We have some questions related to coordinated entry. So Juanita, I wonder if you could take this first one. This question is about whether HUD has given consideration to multiple prioritization standards in a single COC. So can you talk about how people should be thinking about that?
Yeah, I actually answered this in the chat. Can you hear me, Norm?
Yes, I can hear you very well.
Okay. So, yes, communities can opt to have multiple prioritization criteria. It would be on the onus of the community to determine exactly what that prioritization criteria would look like. So it's okay that they do have more than one written prioritization criteria.
Yeah, and I would even go a step further and say, I think it would be weird to not have multiple prioritization methods just because people are in different circumstances and like they're just prioritization questions that you don't need to ask. If it's not going to help you refer someone to assistance, then there's no need to be asking it. So I think it's really important to really tailor your overall prioritization approach, and that very much can mean having different prioritization standards and tools even within a particular COC. Thank you very much, Juanita. So we have a couple questions related to reopening. So we have an amendment question. So Ebony, I wonder if you could take this one. As some states are moving into different phases of reopening, at what point will HUD indicate the last date to submit any expedited amendments? I'm assuming this is referring to the continuum of care amendments, or will they be able to do amendments till we are further down the road of recovery?
Can you guys hear me?
Yep.
So usually we are considering the amendments for CARES Act funds associated with the mega waiver anytime submitted between March 31st and October 1st, 2020. Those are the dates where we are considering the expedited amendment process for that. And then after October 1st, it goes back to the regular amendment process.
Okay, so that's for ESG, and how about for COC? Because we have the expedited budget amendment process. How long is that going to remain open?
For COC, that will continue to remain open. I don't think we've put a date to close it yet.
Yeah, my sense is that we're going to leave that option open for quite a while.
Right.
So we're not like, it's not going to stop next month or the month after. I don't think we know long term, but we don't have any plans on stopping that process.
Right.
Great. So let's see, we have a question. Oh, wow, we have some very technical questions here. I'm going to save some of those for later. One thing that somebody in the chat box asked for, and I wonder if any communities have examples of this, is looking for a sample scope of services for CARES Act funding. So I don't know if anyone's already responded to that, but sounds like that's something that would be extremely helpful. We had an interesting question about, and I'm going to give a complete non-answer to this question because we really don't know how to do this, but we had a question from Susie about how to forecast demand on rent and utility assistance when the eviction moratoria end. And I think this is something that everyone is struggling with. Obviously, we're reading a lot of the research on this, and people are making projections, and the numbers look so big, it's really hard to tell exactly what's going on. I will say we are working on putting together a future webinar on homelessness prevention. We don't have any dates set for that yet, but please stay tuned for that. Those are the kinds of topics we would like to discuss during that webinar. Have another question about, Abby, I wonder if you could take this question about homelessness prevention. So we have a question about, has HUD shared or do you plan to share any sample prevention prioritization assessment tools that you think help ensure folks use ESG prevention funds for the most likely to become homeless but for the assistance? This person is familiar with SSVF prevention assessments and have seen others from various communities, but they're wondering if HUD has any particular ones that we think are good and effective at targeting prevention assistance. Can you talk about sort of like, I know this is something you look at a lot, what you know about this and recommendations you have for communities?
Yeah, can you hear me?
Yep.
Okay. I have a couple things. One, I would say that the SSVF prevention tool is a good one. So if you're familiar with that, you might just want to use it for the general homeless population as well, or general at-risk population. But we are also working on a series of products related to prevention that set up a framework for people to think about. So using selected group strategies like Norm talked about a little bit earlier, where if you know that there are certain risk factors in certain groups, that you can select groups that are likely to become homeless but for the assistance. You can also use indicated group strategies, and this will all make sense when it's on paper probably, so if it sounds like I'm talking nonsense, I promise it'll make more sense when we have it written down. But the indicated group strategies are based on data that you know about. So you know that folks in certain circumstances are more likely to become homeless than folks in other circumstances, that you can then target those groups. And then the other thing that you can do that is very effective is using your prevention really close to or at the front door of your coordinated entry or your shelters to divert folks from entering the crisis response system. is also really effective, and you don't even need to be super good or super precise with your targeting because people have already self-selected because they're showing up at the door. So if you're offering prevention at that point, that's also a group that is way more likely to become homeless but for the assistance. That is just like a brief statement on it, but we are working on those products that will lay this out and also help you set up like clear targeting tools and set up like a good, effective, and efficient prevention program.
Thank you. I know we had some requests for a link to the SSVF prevention tool. And
I
like
can
right
try to dig it up. Oh, nice.
No, somebody already
Thank
beat you to it. So this is like magic power to just, you can ask for stuff and it magically appears. And I want to sort of direct a follow-up question to Emily, because at the same time we're trying to prevent homelessness, we're also trying to identify people who are coming into the homeless system who are possibly at high risk of spreading COVID within the homeless system. Can you talk about, outside of the homeless system, what are some of the high-risk categories? I know people, certainly in nursing homes, there seem to be high rates of COVID. Can you talk about what are some of the other sort of living situations and scenarios we should be looking at where if somebody's coming into the homeless system from those areas, we should be sort of, take extra precaution and be taking extra steps to make sure everybody's safe?
That's an interesting question and certainly an important one in terms of introduction of the virus into shelter settings. So when we think about high-risk areas, it's going to be where do we have places of potentially high incidence. So one way, of course, the way that we originally thought about this was with travel. So the risk of being infected was associated with where you had been recently. Travel might become something that we will think about in the future again, but right now, some of the areas that have outbreaks that have become pretty extensive are correctional facilities. So we know that there is some back and forth between shelters and correctional facilities. So that is something to be thinking about. And then also, one of the other places that we might have some back and forth with is high density working areas. So places like food processing, meat packing, those are some places that we've seen outbreaks because of crowded conditions. So those are two that I would point out now. And then as we move forward, just keeping an eye out for, especially in your local area, if there are outbreaks that are in the media or posted on your local health department website, just keep an eye on those to see if there would be any interaction between your clients and those types of facilities.
That's great, Emily. Extremely helpful advice. Thank you. And that question was a little out of the blue, so thank you for addressing that. So we have a few questions, a few more sort of more technical questions related to the ESG program. So one is related to verifying disability. So Ebony, I wonder if you could tackle this one. So PSH providers can continue making due diligence efforts to reach third parties to verify disability. Obviously, people have the ability to use the waiver to allow for self-certification, for example, of disability. But with respect to looking at third party, and sometimes just in the course of providing assistance to people, having a release of information can be very helpful, but signing a consent to release information is often challenging these days. So this person is asking about whether the oral or verbal agreements to release information, if those would be allowable for a short period of time, and then to get the sort of the more formal written approval at a later date. Is that something you think passes muster, or is there something people should be thinking about differently about that?
Yeah, it's something that we would currently allow. We don't have any restrictions on using, say, e-signatures or electronic or voice signature, and that would be sufficient. So we definitely recommend it right now, as folks are having a little bit of difficulty getting actual wet signatures from participants. So we think that is a good idea to be able to get at least a verbal voice signature from the participant for any intake and certification documents.
Yeah, and I think the questioner, indicated that they would go back to get a written signature at the appropriate date, which makes sense. It's always helpful to just make notes in your case file about what you're doing so that everything is well documented. That's great. I also want to point out.
And that question was for ESG, but on the COC side, we also recommend that the signature, that will be in your written standards as far as what the COC would do. It's always helpful to have that process written down in your COC written standards as well.
Great. Marlisa, we have a question about, it's nominally about the waiver, but it's really about the question of how long waivers are available. So for the waiver lifting the 24-month rapid rehousing rental assistance limit, it's available until the local public health official has determined that special measures are no longer necessary to prevent the spread of COVID-19. That is incredibly broad, vague language. And it seems like there are many ways to interpret what that means. Like, how should people be thinking about that? Is that, how literally should they be taking it? What counts as special measures? What recommendation do you have for people about how to interpret that language?
So we will, I would say in part, stay tuned for the notice for more specific information about what you should be looking for to fulfill, to get a specific idea about what we're looking for. But in general terms, like this is going to differ from community to community. So I think HUD's approach or intended approach is to be pretty flexible and to keep things pretty general so that you can adapt this to your own community situation, including just not specifying like a particular public health official, whether it's city, county, state, or and then also just the special measures that are in place vary so widely. So it really depends on the special measures that are being put in place and whether and when those get lifted.
Yeah, and I don't think I have anything to add, but I will say, I don't think we know exactly what's going to be happening or, how things are going to play out over the next several months, but we certainly, I hope people are getting from these office hours calls the sense that we are definitely emphasizing, safety first, to take all, be as focused on addressing COVID as you possibly can. We are going to be as flexible as we possibly can with respect to this time. And I think you should absolutely, if you're doing it because you're concerned about COVID, then that's a special measure. And we'd certainly want you to be keeping people safe. So thank you, Marlisa. And Marlisa, I have another question for you. So a lot of communities have gotten CARES Act funding for ESG, but many of them haven't. So can you talk about, municipalities that have not received CARES Act ESG funding directly or sort of indirectly through their state yet, but have a high percentage of people experiencing homelessness, either in encampments or shelters. What suggestions do you have for funding going forward? They're obviously trying to practice social distancing, which means decompressing shelters and needing more shelter space. Do you have suggestions for resources other than ESG that they should be looking at to help out with this?
I would say that it's really important for them to be in touch with their local continuum of care, who hopefully has a partnership formed with local public health and emergency management. And if they don't, there's nothing that would stop municipalities or jurisdictions to directly go to, their own public health department, emergency management, and make sure that, they're aware of this need, and then also escalating that need to the state so that you can be included in any sort of FEMA assistance that's available. There's also the Community Development Block Grant Program. There are CARES Act funds associated with that program that are extremely flexible that you could use. But just because you have not received any like ESG or CDBG CV funds directly at this point, it's still really important to be in touch with your state recipient or CDBG state recipient or local government recipient if you're a city contacting a potential urban county that may receive ESG funds or CDBG funds directly. To make it known that you have this need. They may not know or have it on the radar that you need this funding. And for ESG, at least, advanced funding is possible. So states and local governments can advance funds. So I would just say reach out, even if you think that it may not necessarily be a possibility.
Yeah, and I would add that the Department of Treasury has a coronavirus relief fund that is available to states, and there isn't a ton of information about it yet, but one of the explicit activities they talk about is homelessness assistance. So that is also another approach you can take. I think at this point most states are plugged into that funding resource, but that's definitely something you can talk to your state about. So I have a question here I wanted to address to maybe to Emily and Marlisa. Maybe Emily, you could take the first crack at this. But in regards to reopening, the questioner is asking about personal protective equipment for staff and clients and what the best ways are to obtain that equipment. They're having particular trouble finding masks and thermometers. So I know the answer is different for every place, but I don't know if you have some thoughts about where are people, especially shelters and non-congregate shelters, where are they typically getting personal protective equipment for their staff and clients these days?
Hey, this is Emily. I actually don't have a great answer for that, so I would love to defer to Marlisa if she has an answer.
Sure, and I, in turn, will welcome Darlene, one of our TA providers, to chime in because she has a lot of on-the-ground experience with communities who are dealing with this very challenge. But again, I would emphasize how important partnerships at the local level are between, with public health, emergency management, and then also escalating this need to your state because they have that ability to tap into supply chains and FEMA resources. So that is a really direct way to try to get access to those resources. But I invite you to add anything, Darlene.
Thanks, Marlisa. Can you hear me?
Yep.
Great. Most continuums of care have been really successful at coordinating with emergency management to receive PPE for their homeless service providers within the community. And some organizations have also been successful at coordinating PPE through Healthcare for the Homeless partners as well.
Great, thank you, Darlene. And Marlise and Emily. So we have a question about, I don't know what order these questions came in, so I apologize if some of these have been answered already, but so the question is about whether we recommend that communities use prevention screening tools for COVID assistance specific community funds, so not necessarily just ESG CV funds, but other types of prevention assistance. We know that a lot of communities are setting up prevention programs either through local resources or other resources outside of CARES Act funding. So I wanted to address this because I think there are some important nuances to doing prevention assistance that it's really helpful to think through, and that sort of will get you to the answer to how you should think about screening tools and things like that. So one really sort of important planning step to take is to really look at how many resources you have for prevention. Do you have $100,000? Do you have $10 million? And then to just really try to roughly size your target population and to make sure that your resources match up in some way with your target population. So if you want to do a prevention program that broadly serves people with less than 50% income, area median income, and who have a housing challenge that that would be helped with rental assistance or some other kind of financial assistance, so that's a lot of people. So if you have a very large resource, and you have enough to serve 50 to 100% of the people who fall into that category, then your screening process should be very simple, right? You just look at people who meet the income test you're shooting for and meet some definition of housing challenge, and that's sort of the approach you would take. Whereas if you have you don't have enough money to serve all those individuals, and you are looking at you really want to just focus on the highest risk individuals, then you might want to look at, say, people exiting criminal justice or exiting foster care or exiting institutional settings, or people who are applying for shelter assistance because they've already lost their housing, or people fleeing domestic violence. So you really want to make sure that you have a resource that is matching your overall goal and your target population. And then that sort of guides the question about, okay, then what does your screening tool look like? So if your goal is to really look at people coming from high-risk situations, institutional settings and such, then you'd really want to tailor your screening tool to that. And you'd also really want to communicate to your partners and to the public that what you're you're going to be looking at people who have these specific criteria, that you're not looking at sort of generally providing prevention assistance to a much larger population. The thing you're trying to avoid here is having 1,000 people apply for 100 slots of prevention assistance, and wasting a lot of people's time and frustrating a lot of people. So you really want to avoid that. So again, the risk factors that Abby talked about, and some of the some of the research that's out there. I think somebody put up a post to the Canadian Hub. They have some great resources on prevention. Mary Beth Chin is a researcher who has done a lot of work on prevention and prevention risk and homelessness risk factors. And but you're using the risk factors not just to do like this is your screening tool, but you're really looking at them to plan your overall approach, to identify your target population, and then you're going to look at the interaction between your target population and how many resources you have available, and that's what your screening tool is really going to be focused on, is how do we make sure we get the right individuals that we want to that resource. But more information on that will be forthcoming. We have a lot of people hard at work on developing some tools to help you all work through these things. So we have a question here, changing direction slightly. Abby, I wonder if you could take this question because it covers both coordinated entry and HMIS. And the question is that they have set up coordinated entry through HMIS, and they're currently using that system, the coordinated entry in HMIS, to divert prevention clients out. So it sounds like their workflow is to, if there's someone who needs prevention assistance, they're not using that coordinated entry setup to screen for prevention assistance. They're wondering if they should change their workflow to now accept prevention clients, and would that be a temporary thing or a permanent thing? So could you walk through some of the things they should be thinking about? Because I think the answer is probably you could actually go other direction. But can you walk through some of the steps they should think about as they're figuring out how to set all that up?
Yes, I can try, and then I will also direct you to absolutely talk to your HMIS lead and your HMIS or system administrator, and make sure that that person is part of HUD system administrator calls. Because they get very weedy with all of this, and that'll be a really good resource for you. But what I can say at this point is any ESG-funded prevention, including the ESG-CV prevention, has to go through the community's coordinated entry. And the ESG-CV data collection and reporting is going to happen in HMIS. So you want to consult with the stakeholders that are involved with with overseeing the operation of HMIS and coordinated entry to determine the extent of any changes in workflow and the duration of the changes. They're going to be determined locally. I don't think that there's a whole lot that we can say beyond that. Each software is different. Workflow changes may or may not be necessary to meet your need to manage this prevention through coordinated entry. I'm sorry, I feel like that was really a non-answer, but maybe in the non-answer you will feel the freedom.
Yeah, I think that's that sort of is an important answer to this, is you actually have a lot of options here, and you know, we have some technical assistance that can help you implement whichever option you decide, but you don't have to run everything through the same coordinated entry process. I think it's worth distinguishing here between sort of coordinated entry as a function and a coordinated entry location or a particular coordinated entry process. So your community as a whole, your COC as a whole, has a coordinated entry process, but it can also have various different access points and different assessment tools and even different sort of approaches, coordinated entry approaches for different populations. We talk about sort of that as all one coordinated entry, but actually there's a lot of differentiation, there's a lot of nuance. We had some comments earlier about in a large balance of state, how, you know, do you do the coordinated entry the same way in every single region in your state? And, well, not necessarily. So you really want to think about what resources are available, but I just think it's important to think about, like, you can have a coordinated entry for prevention, and you can have a separate coordinated entry for your other assistance. You can have one dedicated to people fleeing domestic violence. We talk about this as being your coordinated entry, but really in practice it can be a lot of different things, and you have a lot of flexibility about what you sort of integrate all together versus what you sort of operate and think of separately. I think the important thing to work on as you're doing that, though, is to make sure that if somebody just goes to the wrong place, metaphorically, that you actually make sure that you have a quick and easy way to get them to the resources they need, even if they didn't access the coordinated entry in the way you expected them to. So thank you, Abby, for that. So we have a question about, Ebony, I wonder if you could take this one. We have a question about COC rapid rehousing projects. So we have a waiver regarding the 24-month limit on rental assistance, but they're asking about people who had reached their 24-month limit prior to May 22nd when that waiver came out, and whether they're able to resume rental assistance for those clients who will otherwise lose their housing. Can you talk about, is that something they would be allowed to do?
So the waiver specifically just allowed folks to continue their rapid rehousing after anything that's after May 22nd, 2020, after the waiver was signed. So unfortunately, I don't think they would be able to do that for anything that was before the date of the waiver, the mega waiver.
Yep, and so what options would that project have? So they couldn't resume rental assistance for that client. What other options do we have for them?
I mean, you still have, they're still available for additional 6 months of supportive services to help them to prepare to be prepare them to find some housing afterwards. I can't think of much else right now. That's what they would be able to do.
Yeah, other than, of course, they'd likely be eligible for prevention assistance under the under CARES Act funding. So maybe it wouldn't be COC funding, but they'd likely be eligible for other types of assistance like CARES Act prevention funding. So thank you, Ebony. We have a question. This is the evergreen question about what is happening with the 2020 COC funding competition. And I will try to remember our evergreen response. Unfortunately, we don't have any updates at this point. I will say, even though we don't have updates, we are actually very actively working on this and working very hard to come to a resolution. And so the question is really about, will there be a 2020 COC funding competition? If so, when will the NOFA come out? So again, we're exploring a bunch of different options. We're trying to find something that will cause the least disruption possible and that will allow us to continue focusing on COVID response and implementing CARES Act funding. I don't have a any specific details about what that will look like, but I would give the same advice I have been giving, which is if your community is affected by COVID, which I think is everyone right now, and you are trying to figure out how to implement CARES Act funding or other sort of major funding that you have, that is the thing you should be focused on. I would not recommend that people shift their attention and start focusing on the COC competition. I think the focusing on COVID response and CARES Act funding is definitely the priority, and I'd recommend that people focus all their attention there. Okay, so
there was a kind of a question, I guess, from a UFA about the UFA notifications and what's happening with them. I think it's pretty much in the same boat for FY 2020. Like, we'll let those folks who apply for UFA for FY 2020 once we're able to talk more about the competition.
Yep, great question. And we are that is definitely one of the things we are working through and thinking about, and we don't have an answer for that yet either, unfortunately. So we will definitely let the people who applied for Unified Funding Agency status know about what our next steps are going forward as soon as we have everything resolved. So it's apologize that we don't have more certainty. We are absolutely working to try to get there as quickly as we can, but that's kind of where we are right now. Okay, so we have a question about permanent supportive housing projects that are configured for roommates. So I actually want to ask two separate questions because I think this is an important and interesting question. So I want to direct one question to Emily about where we have people sharing an apartment, say a two-bedroom apartment with two sort of individuals who, you know, who sort of were placed in a shared housing arrangement, and what steps should we as service providers be telling those individuals to take to help prevent, you know, I guess it's spread between themselves? Like, what are the things that people in a household shared housing situation, what are the things they should be focused on to help prevent the spread of COVID?
Thanks for that question. So that is actually something that we can just think about the general advice for the general public. So when you're within a household, you're sort of, it's kind of your quarantine circle. And the things you want to think about with that are reducing contacts outside of the household. If one member is going to work, you might want to think about whether or not the other member is at high risk. So whether or not the person leaving the household might have potential of bringing infection back. Probably, you know, making sure that the roommates have good conversations about each protecting each other and making decisions to limit their contacts outside the household. Lots of hand washing, of course, making sure that they have the supplies they need to be washing their hands and wearing masks cloth face coverings when they're outside their spaces. So all of those responsible things that people are doing within their households, and as they just monitor their contacts outside the household, those are things that we want to think about when you're in a situation with roommates.
Great, thank you very much. And the related question is about if one of those individuals has to be isolated. So Ebony, I wonder if you could take this question first. I think this crosses over between COC and ESG. But if one of those individuals contracts COVID and needs to be isolated, is that person going to be eligible for ESG or ESG-CV funding to be placed in, say, a hotel room or other sort of isolation site? Are they going to be eligible for that? And can you talk about, I think there are actually some other options that the COC project would have there. Can you talk about that?
Yes, they would be eligible. Some of the other options, I don't really have any other options right now. I know they will still be eligible for ESG or ESG-CV funding to assist with that.
So the answer is yes. Perfect, thank you. And we have a request for clarification about my comments about the 2020 COC competition. Somebody rightly points out that that I mentioned last week, that the HEROES Act, which was passed by the House of Representatives, had a provision about about basically just renewing all COC grants rather than having a COC competition. I will say that was in the act, and it was passed by the House of Representatives. You'll all remember from your Schoolhouse Rock days that to become a law, it has to pass House, Senate, and be signed by the President. So this legislation has not quite made it that far yet. I don't know if it's going to get passed as is. I assume there are going to be, if it passes, there will be some major changes. It's definitely a hopeful sign that it's in that bill, but unfortunately that isn't law yet, and so we can't quite take that to the bank yet. But if something does happen legislatively, that will be, we'll definitely be on top of it. Sorry, did somebody have a comment? Okay, great. We had a question actually also about, we answered a question about 24 months and rapid rehousing, but somebody had a question about 24 months and transitional housing. So Ebony, I wonder if you could talk about what is the, what if somebody comes to the end of their 24 months of transitional housing, and what options do they have at that point?
So in the COC program, they could still, I think the question was on a case-by-case basis, they could still extend that person in the TH project on a case-by-case basis. So that's why we haven't put anything in the MEG waiver about TH program. So that's still an option for us. I'm not sure if we're going to, I'm not sure if we're going to add it into a mega waiver or anything like that. But you can definitely do it on a case-by-case basis.
Yeah, but that I think is an incredibly important point, that you don't need any additional authority. This is, you know, under exceptional circumstances, you can go past the 24-month period, and this, you know, these kinds of cases would certainly apply. So you do not need any waiver to do that. That is something you can absolutely do currently. If you have any questions about it, actually about that or any of the other things we've been talking about, please feel free to shoot us a question on the AAQ Ask a Question desk, and we're happy to answer that. Also, I see a lot of Schoolhouse Rock fans. Sorry to send us down that rabbit hole, but fond memories for me, definitely. Okay, so next question here. Wow, a lot of there's some great questions here about admin costs and the COC program. So I want to, Ebony, I'm going to sort of direct this your way as well. So this individual is a recipient and pass-through entity for a number of COC rental assistance grants. They're asking about whether any of several costs would be allowable as program admin costs, as their grants are solely rental assistance, so they're unable to allocate other parts. I assume supportive services is the main one. So the costs are for their subrecipients to help mitigate the impacts of the public health crisis. So they're asking specifically about personal protective equipment, cell phones and data plans, or Wi-Fi for tenants, and retrofitting PSH programs with Wi-Fi. So they're asking about whether any of those could be admin costs, or if they have any other options if they only have a rental assistance budget line.
You do. They could be admin costs to the extent that they, you know, you can fit them under our, in 578.79, under our admin, assuming that you can fit them under the eligible costs that are listed in our interim rule. So, and it's actually, I think, pretty broad for admin costs, you know, general management, oversight, and coordination of the grant itself. So to the extent that you can fit those items under there, you can, it could be considered admin. you could also, as a rental assistance program, if you have additional, if you have extra funds in rental assistance, and this actually happens a lot more than folks think, you can move some, you can do an amendment to move some funds from rental assistance to supportive services. And and we do have in our mega waiver, in our second mega waiver, we do say that for that amendment, it will move back to the way it was if the project is renewed. But right now, you can always move some funds from rental assistance to supportive services to help with some of those costs. But you could also use admin costs if they fit within the general management oversight and coordination of the grant.
Yeah, and I would just point out that, like, we created this very streamlined process to do that amendment. We addressed this on a previous office hours, or maybe it was the recipient's call, but we have a website with everybody's grants and a pre-filled out amendment, and you can just go there and, move like $10,000 or whatever you need from rental assistance to supportive services. And again, it's like Ebony said, it's a temporary amendment and very, very easy to do. If you have questions, reach out to your field office. I'm sure they'd be happy to help you through it. But also, I think, so Ebony, I think there are some things that you could charge just directly to rental assistance because they're part of the process of doing rental assistance. So I don't know if the client is using a cell phone to do the inspection, to inspect the unit and to sort of do eligibility determinations, would that be a way to get some of those costs paid?
Yes, you can get those costs paid through your actual rental assistance line item.
Yeah, so any protective equipment or data plans or things that are needed to administer rental assistance, as Ebony was saying, definitely would be eligible under the rental assistance line. So that brings us pretty much to the end of our session here. So I definitely want to thank our presenters today. Want to thank Roger Casey for sharing with us some great resources. I know that taking care of ourselves is a really important part of getting through this. So I thank you so much for providing us with those resources. I want to thank Emily, as always, for giving us some great updates. You never seem to not have an answer for some really tough questions. And I want to definitely thank the SNAPS team, Marlise, Ebony, Juanita, Abby, for joining us today and giving us some great information. And definitely want to thank our technical assistance providers, Natalie, Tommy Joe, and many, many people behind the scenes that make this happen. And again, want to just thank all of you who are just, plugging away at this work and keeping people safe and saving people's lives and doing the incredible work of preventing and ending homelessness. I just have immense respect for the amount of work you're doing and the sort of dedication and focus you have. And I think, think the world of your work. So if you have any future questions, please go ahead and send those along to us. And we will see you on the next office hours. And that concludes this session. Thank you.